Deuen estar en una caixa aquí dins.
Els anècdotes del Intensitity pot que estan aquí dins.
Ok. Perfecte. Okay, see? Hello. Hello, good evening. Welcome to our booth in Cosmoprof Bologna. My name is James Abate. I'm the technical applications trainer from company Beco Spain, Beco Medical from Barcelona. Okay, so now we're going to do a demonstration of this technology that is called HIFU, due to the fact that our shot will be very, very, very small. Maybe it's better to call it MyView, okay? Micro focused ultrasound, okay? When you see that here in this machine that it's called Ultralift HIFU, okay? What we are following is to increase the temperature of the tissue around 70 Celsius degrees. So we are following what we call thermocoagulation. So obviously it's a thermal ablation of the tissue. Yes, can you hear me properly? Yeah, it's good enough. Okay. So in this case, this ultrasound that is emitting in a high energy, okay, in a continuous way, is increasing the temperature of the tissue to do or to follow a thermocoagulation. That will probably increase the natural healing process of the body in this tissue, because we are doing micro wounds, micro burns inside the tissue. Okay, that's right. So we could say that this is a step below from the radio frequency that is normally the main known rejuvenation technique. So here, as you can see, for instance, if we want to treat the neck because we see that there is a skin laxity, or there is muscle laxity, or there is an excess of fat tissue here on the double chin or in the cheeks, okay? With the MyView, we can deposit the energy where we want. The only thing that we have to do is to change the transducer that is here on the hands. So when we change the transducer, we will obviously, okay, concentrate the energy here. This depthness. As you can see, each transducer has the depthness, the working depthness. Okay, in this case, 3 millimeters. So this is the transducer for treating dermis, skin laxity. But we can use another transducer, for instance, of 1.5 millimeter depth. So we are depositing the energy in the epidermis. So that will be the transducer to improve wrinkles, for instance, to improve the microcirculation on the epidermis, okay, for instance, in those skins that they are very dry because of the age and so on. So with another transducer from 4.5 millimeters, okay, we will go to treat those fat tissue accumulus, for instance, here on the double chin or the cheeks, okay? And maybe even with the 4.5 millimeters, we can go to work on the muscle to improve muscle toning, okay? So that could be very useful to change the transducer, because in one treatment session, we are able to treat several things, okay? So quite interesting. That's right. Okay, let's go. So, if we decided now to work on the neck, we must perfectly draw, okay, the borders, the below border, the upper border, and here there is a area that is defended to work. Okay, so we cannot work up on the thyroides. That's right. So this is the only part that we have to be very careful. That's right. The only part, all of the rest, we can perfectly work with it. What is the distance that the transducer will impact? As you can see here, there are two lines that will show you exactly the point where the transducer will do those micro wounds, micro burns. Okay, so it's 2.5 centimeters. So that's why that when I apply the transducer up on the skin, okay, I must draw like, okay, lines of 2.5 centimeters of large. That's why I take here and I draw up on her. That's right. Those lines, yeah. You can put here hyperextension. We draw the mild. Okay, here. That's right. Here on this part, you know that the tissue is very thin, okay? And we already have here the larynge and the pharynge. That's right. So it's dependent to operate here because it could be very harmful, very painful. That's right. So we always work on the lateral side of this part. Okay, let's suppose that now we are deciding to work on the left side of the neck. Here, let's suppose that we saw that there is an amount of fat tissue here on the double chin, 4.5 millimeters transducer. In her case, there is no needle, okay? There is no fat tissue, okay? So I think it's better for her to work with a 3 millimeters transducer. As you can see, there is not much skin laxity. As you can see here with the test of the credit, okay, there is no excess. Maybe we are pinching, there is a little bit, okay, you can see here this movement, rotation, but then the response of the tissue is quite good. Okay, that's right. So now we can take the contact gel. We always work with on gel. That's right. So we take some conventional, some contact gel, and we can apply it here in all the treatment area. That's right. Not much. Just a few to be sure that the transmission would be nice. Okay? To preserve the transmission. So here, we already put the 3 millimeters cartridge here on the handpiece, so the machine recognizes it. After that, the energy. As much the energy we can increase, the result will be better. Okay? So we have to try to go to the upper energy. The maximum is 3 joules, okay? But because of today, it's the first treatment session, we will decide to go in probably 2.5 joules, okay? And then spacing. That's the amount or number of mini shots that we will deliver in each shot that we give, okay? So in this case, 25 mini shots. Okay, let's press the button. Okay, we follow a good contact with the skin to avoid air to be between the surface of the transducer and the skin, and we press, okay, the button. So now she's feeling like small pinching, okay, inside the tissue. What do I have to do now to move very, very close the transducer? Because each mini wound that we are following inside, it's 120 micros. So it's very, very, very small. And I move it, okay? Very close. That's right. What I have to avoid to do is to make a jump. No, it's not good because I am creating some air bubbles on the gel layer. Okay, so I only have to move in translation. Okay, like this. If there is enough gel, it's not difficult to do that. So, in the case of Carlota, our model today, she's very thin. I probably cannot increase the energy as far with another people with a very thick skin. Okay, so I must be aware of that. So the explanation or the reason to increase or not the energy, that will be the thickness of the skin. Okay. So now the only thing that I have to do is to move the transducer and to go far away, far away, far away. That's right. If sometimes you see that the air is very hot, so the contact gel is getting evaporated, you just have to put a little bit more. So it's very, very important to have enough gel. If not, the technique will not work. Okay? And we continue working. So, if I make the shots very close one to each other, it's better than not do it. And then the time between the shots has to be the minimum. So we will concentrate the energy. We will increase the temperature. So the result will be much better. Okay? You can strengthen, okay, the skin, and you work like this. You also have a pedal. If you prefer, instead of using this button on the handpiece, you can use the pedal with a foot pedal, yeah? Okay? So everyone can choose. And you have to follow all the line up on the bones. You have to go until the bones. And you have to shut on the bones. Okay? Let's suppose that we are already up here. The shot that I will deliver up on the bone, it's absolutely true that will be a little bit painful. That's right, because the surface of the bone, it's quite sensitive. Okay? But I have to do that. To finish there and to repeat this exact line for a second time. Okay? Each line has to be repeated 2 times. So 2 times here, 2 times here, and so on. There will be some necks very large, very wide. Okay? And maybe we will do 3 lines. In her case, with 2 lines, it's enough. Because she has got a small face. Okay? So that will depend. Really? Okay? And that's all. And you shot several times. So here you will see the number of shots that we are delivering. And maybe in a neck, you will be around 2,000 shots. Okay? Why? Because maybe you will do some shots with a 4.5 millimeters depthness, and even you will work with a 1.5 millimeters transducer on each wrinkle that you will see here as horizontal wrinkles on the neck. So the combination of the 3 transducers in the neck can achieve 250 shots. That could be possible. That's right. And the way of shutting, you know, I'm not pressing anymore, no, nothing at all. I'm simply getting sure that there is a good contact. That's all. So it's not very difficult. It's not very tiring. Nothing at all. Obviously, the patient now is feeling those pinching sensation, but it's quite comfortable. Okay. That's right. So, if we want to work close to 3 jowls, maybe it's interesting to put some anesthesia, tropic anesthesia, with EMLA and so on. Novocaine, lidocaine, procaine. Maybe it's useful. If not, and we want to work without anesthesia, maybe we can work in lower parameters, but then we will repeat this line, not 2 times, maybe 3 times. At the end of these 3 times, we will obviously accumulate the energy, okay? But 3 times would be useful, okay? When we work up from the mouth, okay? And we treat the jaw, okay? And maybe here it's quite difficult to work because normally medicine doctors will inject hyaluronic acid to do or to follow, okay, the filler effect. So here we normally don't work, but yes, outside from the mouth, okay? So we have to be aware here there is a nerve, a superficial nerve, okay? So if we impact on the nerve, that will hurt a lot. So we have to work in this sense. That's right. Here, on the, for example, below the eyes, okay, we can work with a 1.5 transducer to improve those dry wrinkles that will appear in some people, okay? And obviously here on the front line, we can perfectly decrease these wrinkles once again with a 1.5 transducer. It's impossible to work with the 3 millimeters or the 4.5 millimeters here because it hurts a lot, like in the eyes or in the lips. That's right. Always 1.5. That's right. But the way of working is exactly the same. You change the transducer, you apply, you put a little bit of gel, and you shut. That's right. And you repeat the same line a minimum of 2 times, maybe 3 times if you decrease the energy. Okay? Perfectly. So, as a resume of this machine called Ultralift HIFU for skin tightening or for face rejuvenation, that could be useful. So tomorrow we will repeat it with the other machine that we have, the Ultralift HIFU Evo, because you will see another thing to do with HIFU. It's body contouring on the abdomen, hips, thighs, arms, etc. Okay? That will be with another transducer that is bigger and that will deliver 24 lines of 24 mini wounds in each one. Okay? So if you want, tomorrow, Sunday, here on our booth, in the morning, I think around 10:30, we can do this demonstration with Ultralift HIFU Evo. That's right? Okay, so thank you a lot. See you tomorrow morning. Okay, and we continue with those demonstrations in Cosmoprof Bologna. Thank you. Bye-bye. muove. Mi fa studiare un po'. È una macchina che sul il viso